Let's Talk on Facebook and YouTube. And I'm your host, I'm Mrs. Winnie Ohinekisi. I hope you are phoning your friends to join in because tonight is the very last episode of Let's Talk About Health for 2021. 2 weeks ago, we had Dr. Robert Khan in the studio and we looked at sickle cell disease or sickle cell anemia, looked at all the complications. But tonight is a special program and we have patients here, we have a practice nurse here as well, and we are going to see how people actually live with sickle cell disease. But all this is coming to you by proud sponsorship of Omega House Multimedia, Omega Live TV, and Omega House specializes in doing flyers, leaflets, posters, brochures, booklets, banners, you name it, everything in media, they have it, and they are very reliable and you can use them. So in 2021, I hope you make absolutely good use of Omega House Multimedia. Like I said, Dr. Khan was here 2 weeks ago, and before I get tonight's program rolling, I need to go through those who have featured throughout the year of 2021. And I want people to go back and watch all the programs you've missed out on in health. And so just taking a minute to go through to catch up on a few of the programs that you may have missed. And I'll say that if you go to the Omega Live TV website or on my page on Facebook or on YouTube, you can catch up with all these very important topics. So we've been looking at the vaccines in Twi or in vernacular, local Ghanaian language, on the vaccines and COVID. I did that with Dr. Khan earlier on in the year. And then 2 weeks he did sickle cell anemia and disease. I had Nana Ajwa Asante with us, and she did sepsis and told her survival story. Mr. Adam Mapani did diabetes and eye health. Mr. Douglas Trinifo has been here a number of times, and he looked at putting diabetes into remission, a pragmatic approach to weight loss and making healthy food choices. All these are on the pages and you can catch up on them. And then we had the amazing Trowbridge Foundation with us, and we looked at why mothers die. What are the causes of high morbidity and mortality rates in Africa, with emphasis in Ghana? And they were here again to look into managing major obstetric hemorrhage, and then we also did preeclampsia. So this is pretty much what we have been doing, but the content is amazing. Tonight we are closing the year. It promises to be an amazing one, and I have got 3 guests with me, and I have a very special lady. You'll find out why she's so special. Ruby Mills Odoy, Sister Ruby Mills Odoy, and she is joined by her son, Kwame Asari. Kwame, you are especially welcome here because I think you are my youngest guest ever so far. So I'm particularly thrilled that you are here. And then I have Miss Marjorie Oseje. She is Mrs. now, but Marjorie was my classmate in secondary school from 1 at Infants Mangel Secondary School. So I am really excited that Marjorie is with us. Tonight, you are all very, very welcome.
Thank you.
You know how excited I was when I was able to bring you all here. And we couldn't wait. So, Auntie Ruby, I think I will start with you because I really want us to capture everything, how you have been managing all these years as a sickle cell patient. So, how did it all start? How did you get to be diagnosed with sickle cell disease?
Well, I remember when I was about 6 years old, I happened to jump from the top of the stairs because we were going to meet my dad, and we were all so excited. Everyone wanted to get there first. So I thought the quickest way to do it was to jump. But then I fell on my arm and it got swollen. I was taken to the 37 military hospital and was put in plaster cast. But that night, it wasn't a pleasant night at all. My arm started swelling up. Everything was just so painful and uncomfortable. So in the morning, my mom was a nurse, so she looked at it and she felt no, something was wrong. So she cut the plaster cast and we went back to 37 hospital. But then I was transferred to see Dr. Ofusuama at Kolibu Hospital, and that was where I was told that I had sickle cell.
Right. All this is obviously happening in Ghana.
All this happened in Ghana.
So a lot of your management as we go along has been in Ghana and in the UK.
Yes.
Yeah.
Yes.
We will come to a book that you wrote, which I picked a whole lot from. But then, because you have gone through so much in your health along the line, I want us to focus on your adult life, and there's a reason for that. And some of the very touchy, very emergency situations that you experienced, which were all like near misses, and by that I mean you nearly died with these encounters. So which are the notable ones, really?
I think the first one, which I'll pick, is when I was pregnant with my daughter. That was in 82.
Yeah.
Sorry, 87. I just went to the hospital and I was told that my blood was so low. At that time, I had never been given blood before.
And if I may ask, how old were you at that stage?
I was almost 30. I was 29.
Right.
And they told me they were going to give me blood. I wasn't really happy about it at all, because all my life in Ghana, living with sickle cell, I never had any blood transfusion. So they went ahead and gave me blood.
Yeah.
And the next thing, I realized that everything had changed. My palm was yellow, my skin was yellow. I mean, I just couldn't breathe.
And that was post-transfusion?
Yes.
Okay.
And, I mean, things started going downhill from there on, And it got to a stage where the doctors were trying to determine whether to terminate the pregnancy so that I live, or I should carry on. And it was like... That girl was a fighter. She didn't want to go.
How far advanced were you in that pregnancy?
I was 5 months, 5 to 6 months. So it was really touch and go. Really, really touch and go. And that was the start of a whole lot of things for me. The crisis kept on coming, one after the other. It was pretty bad. Pretty
Prior
bad.
to this age of 30, you had already had a child.
Yes.
Yeah. And that's Kwame.
Yes.
And you had no complications whatsoever.
No. No. I didn't have... Well, I had the odd sickle crisis and things. And at one stage, I was in hospital, and it was because at that era, there was this curfew going on. So the doctors thought that it would be best for me to remain in hospital than to be rushed into hospital every night. So that was it. And it wasn't as bad as the second one.
Yeah. So what was the complication following the transfusion? Or did they put it down to anything?
That was it. Till date, I don't know what went wrong. No one told me anything, but at that time, I knew I was going. It wasn't pleasant at all.
It wasn't pleasant
at all.
That was like the first
scare that I'd ever had. Well, in adulthood.
Yeah. Did this pregnancy go to full term?
It did.
It did.
It did.
So you beat that.
I did.
Wow.
They didn't think it would, but I think it even went beyond full term.
And then eventually you had a normal, healthy baby, and it all went well.
It did.
Yeah. I remember reading your book and picking up on some complications. And one of the notable ones was you having a fractured spine. Yeah, tell us about that.
I don't know how that happened.
So
It's
prior to going into hospital, you didn't have a fall or nothing at all whatsoever?
no. They think it. I must have been born with it.
Okay.
That's what they think, because they can't tell why the spine kept curving. As I grew older, the spine just kept curving and curving, and it caused a lot of discomfort and pain, especially when I'm walking.
Yeah.
Yeah, and well, I'm still living with that. It hurts.
Yeah.
Especially sometimes the way I lie down also makes a difference.
Yeah.
Yes.
And at one stage, you were not going to walk at all.
That was another story. That
Yeah.
With that one, I just woke up one day and I just couldn't walk.
Oh, so
I couldn't
wasn't
get out.
related to the spine?
I don't know what it was related to.
Okay.
But I just couldn't get out of bed. I couldn't walk. But I remember that when my children were younger, I used to ask them to just walk on my back.
That's probably not a good idea. Yeah.
And no one should do that. But that was what I felt was going to help at the time.
At the time.
But this particular day, I just woke up and I just couldn't do anything at all. So I was rushed to the hospital. And I was sitting in the doctor's room just looking at these x-rays. And I was saying to myself, gosh, this person must have been through a very terrible accident. I was just looking at the x-ray. And then
Not knowing it was yours.
it was mine. It was mine. And then the doctor came in and I was like, no, this can't be me. This can't be me. And they said, well, they are not sure if I'll be able to walk again. The way the spine is, the way they were just going on, and it was like, I just couldn't believe it.
Wow.
And I was stuck in a wheelchair for over a year.
And then you started walking again. Miraculous.
Just one day, I just decided to this voice was saying to me, because I really wanted to use the loo and there was nobody around and I did not know what to do. So I just held on to the banister, and I kept hearing this voice going, go, go. So I found myself
way up
there. And then I said to myself, that's it. I'm not going to sit in that chair again.
Wow.
Whatever happens, I'll do my best and walk.
You see, I really like expert patients who really know their conditions inside out. And I was amazed to see the documentation you've put down on every single thing that has happened to you since you started going into hospital. And I will just go through a few of them, not a lot. And that alone can pretty much fill a book. I was quite surprised because it's very important to know the medical history of
I think it's really important.
Yes, and yours is almost like a whole booklet. So I've got down here, and this is going way back in 1960s. And I was amazed. From intestinal obstruction to chicken pox to scoliosis, high blood pressure, heart attacks. You've had brain surgeries. You've done it all. Gallstone, gallbladder, surgery, and a whole lot of surgeries you've had. Cataract, fibroids, you name it. You've done it all, and yet you have come successful, like on the other side, smiling.
It's just by grace.
It is just amazing. And then I noted your drug history as well, which was another thing that blew me away, because obviously I've been nursing for quite a long time, long enough to think that about 10 allergies. But then I looked at yours, and again, going back from 1996, you had documented all these. did you start all these documentations from that far back?
Yes, I think I started in 1996.
Documenting
everything, because I realized that when I go into crisis, sometimes the ambulance takes you to the nearest hospital and they don't know much about you. You know, you try to explain to them that, no, when they give me this drug, I react this way to it. But they sort of don't believe you, you know.
Yeah.
So I started, you know, putting it all down in a book and telling them what goes on with me whenever you give me these medication. So in my consultants, they all know about this book, you know. So the purple book. So anytime I'm being rushed to the hospital, I just say to the doctor, give me my purple book.
Yeah.
And when I get there, the nurses that know me, they'll just ask for the purple book, go through, and they just know what to do before they call in my notes.
Yeah.
So it's an advice I'd like to give everyone, everyone, not just people with sickle cell, but try to know what you can take, what you can't take, and document it. Yeah. It's really important.
Very important.
It's really important. It will save you.
It will save you. And let me just go through, because I'll let Marge get ready to sort of give us a recap on sickle cell disease and how it's managed in the acute phase, because you two met in one of your hospital visits, and that's why I needed her to be here. But before we do, let's see this for documentation, and that is just the allergy history. Morphine, dimorphine, oral morphine, hydromorphine, methadone, fentanyl, oxycodone, flagyl, you name it. The only thing I can see here is paracetamol. Naproxen, gabapentin.
It's another story.
500
milligram.
Anything else you see for 36 hours. 36 hours.
Wow. Voltarol, pregabalin, nefopam, and then antibiotics as well. Vancomycin, flagyl, which is metronidazole, you know, and these are drugs that are used quite frequently in the management of sickle cell patients because of the pain. So on that note, I think I will come to Marge. Obviously, Dr. Marge, because we are mates, so I think I'm very familiar with that. Marge, let me come to you. Managing our patients, especially in the acute phase, is of extreme importance. And we know that with sickle cell not being that widespread, you know, not many people even know about it. And especially when you find yourself in a country like in the UK, it is very likely that the team looking after you are not familiar with the management of sickle cell disease or sickle cell anemia, especially when they come into crisis. You guys met on one of her admissions, and I thought it would be good for you to come here. How do you manage a patient in crisis, in the acute phases?
So we obviously see them after they've been to A&E. And then because I was on an actual hematology ward, so we had like protocols for someone to, when they came in, what things to do.
Yeah.
So obviously we have to look at hydration. We have to give them, make sure they had oxygen, pain relief, and keep warm, because those are the things that would help them and get better.
Yeah.
So those are the main things that we used to do. So give them antibiotics. If they had a temperature, you have to give them antibiotics. They normally take prophylaxis anyway, penicillin V. But obviously depending on when they come, we give them antibiotics. We give them pain relief, regular pain relief. Obviously in Ruby's case, some pain relief would work for a few days, and then we are happy that it's working, and then we have to change it to something else because it's not working, for her. So it became a bit difficult on what we can give. Even the things that we said, something like fentanyl, you can give it in a patch. So you can put fentanyl patch on First few days, it was managing her pain. Everything was fine. I think 3 days. Then she started having side effects of itching, feeling lethargic, very sleepy, things like that. So they had to like revise it. So most of the time for Ruby, it's mainly pethidine that works for her.
Right.
So because they used to put people on morphine pumps so that you can regulate it, and then you can give them, especially when they came in severe crisis.
Yeah.
But injections was what was good for, and it wasn't easy because every few hours you have to give her an injection
to manage the
to
pain.
manage the pain. Yeah, but once we obviously got on top of the pain, gave her fluids, found out what was causing the crisis, obviously giving antibiotics, and then we sort of get on top of it.
Yeah.
And then she'll be discharged.
So would you say the main criteria for the management, because you've had a look on the NICE website,
NICE guidelines,
yeah. What actually does the guideline say, especially?
So with the guidelines, the main thing was depending on obviously what they came in, what crisis or what stage they were, because they can have a crisis where they don't need to be admitted, so they would just need antibiotics and pain relief at home. But where they come in with a very high temperature, very shivery, pain relief at home was not working, because they have some pain relief at home that's not working. Then we have to do the IV fluids, IV antibiotics, oxygen, all those sort of management.
Yeah.
But my thing about management is that unfortunately there's no protocol, there's no set protocol to say that if somebody comes into A&E with sickle cell, this is the things that you do.
Yeah.
Sometimes they'll sit in A&E for a while until they are brought to the ward before they can get proper pain relief and management. So they might be in A&E for 4 or 5 hours asking for pain relief, and people are not aware. They have to call the hematology section to ask, oh, what should we do, blah blah blah, which is quite hard for them.
Yeah, I see. So that obviously makes it very difficult, not knowing the protocols to follow, isn't it?
Yeah.
Yeah. And is that all that the NICE guidelines could tell about managing these patients in acute phases?
With the fluids,
hydration, and then pain
relief, and antibiotics, bringing the temperature down if they had that. Those were the main things.
So patients and their families coping with sickle cell disease, I'm sure, go under a lot of stress. And helping them to cope during these stages is very of prime importance. Yeah, how do you even tell them about anything to do with stress control, because I'm sure that triggers crisis as well?
To be honest with you, we never through my nursing training here, we never really had any training on particularly helping people with stress in a way. It's just because of the way we nurse here. And because I got to know Ruby, I was like maybe a lifeline in a way to her.
Yeah.
So we became friends. We just hit it off and we became friends. So anytime she's not, even if I'm not on duty, I come to see her. And then at least I'm keeping her company. I'm chatting to her, and she did have a good sort of family and friends that always used to come in and see her as well.
Yeah.
And which was really good. So that's what kept her going. That's what really kept her going.
The family support.
The family support.
Yeah. Would you say that was her secret to her lifeline?
It could be, because she's had she's gone through a lot, and she's managed to have 3 kids, through that. And you have to be there for your kids. Every mother wants to be there for her kids. There's been times that she's been on admission, and Kwame has been on admission on the same time, on the same ward. So, and she would try and get her from her bed when she was in pain to go and see Kwame.
Wow.
As a mother, she would do that, and which that was very inspiring.
And all that was in the UK.
In the UK,
right?
Because I met her in the UK.
In the UK,
yeah.
Yeah, I know you guys are very good friends, so I wanted to see, is there anything special you've been doing? Is there anything people need to know? that would help people's recovery. So it was just more on a friendship basis.
Yeah. I mean, but because we became friends, in Ruby's case, we used to, I used to make sure that I would bring food, because the hospital food was not, and other people also used to bring food. So that also, you know, helped with her recovery, because she would have, you know, if it's light soup, she would have, if it's, so they also helped in that sense.
Yeah.
Which made, you know, a big difference.
A big difference.
to her.
Right. And now to you, Kwame. Kwame, I'm pleased you are here.
Yes,
And thank you so much for coming. I was particularly thrilled when you wanted to come. The reason being that Africans never want to share their health problems, let alone the young ones. It's like, oh no, I'm not talking about it. So I was quite thrilled that you decided to come with your mom to talk about this condition. So Kwame, how did you know about your own diagnosis as sickle cell?
I would say from a very young age, probably 4 or 5 years old, I used to get these pains in the middle of the night. Just wake up with pains all over my body, and I would have to be rushed to the hospital. So I don't think it fully clicked in till I was a lot older, like in my teens, my early teens.
Yeah.
That I began to study about sickle cell and understand sickle cell for myself. So yeah, I'll say from a very young age. Yeah.
From a very young age. And once you started reading about it, what was your understanding of what was going on generally with you?
My thing was to figure it out, to find a way to stop the pains. That was my main goals or my aim. So I understood a lot about it, like how to take care of yourself, how to, maybe like in my situation, you have to plan things in advance. You know, you can't just get up and go out with your friends, even though you want to. But
So
yeah.
before you go on an outing, what sort of things do you come into mind?
It depends on the outing. So
Okay.
if you're going out to play, just make sure, like, if it's in the winter time, dress up warm. Summertime, take water with you, drink plenty of water. They'll say don't run too much, but if you're like playing football, you want to run, obviously. So
Yeah. So did you do the normal things?
I did normal. I tried. I did my best. I
Yeah.
participated in almost
But how
everything.
much did the condition allow you to do those things? Because I'm sure every teenage boy, for instance, would love to take part in sports
Yeah.
at school. Was it limiting?
It was limited at certain times, because there'll be times I'll be in hospital, I'll come out, go to school, and then like if we have sports day where we're competing with different classes, sometimes I'll have to sit out because I've just come out of hospital. So you don't want to overdo it and go back into hospital. So yeah.
Yeah. Preparing for the previous show on sickle cell, I watched a few clips which I had never done actually, online on the sickle cell help page, and a whole lot of other videos that I watched, and a lot of them were actually middle-aged young men and young women, and I tried to get into their mindset. Does it affect them in any way, like in their social life? Would you say it's been had an impact on your adult life at all?
No, I'll say it's been more of a relief in my adult life because I understand it a lot more.
All right.
I understand the precautions to take. So my adult life is okay. I still socialize. I go out. I mean, now we're all indoors these days, but before that, I still go out.
Yeah. So like a typical night out for you.
Yeah, typical night out. So we probably prepare before, maybe throughout the day, just drink water. Just to keep
And that is your typical preparation.
Yeah, to be well
Right.
hydrated
Okay.
when you go out. And when you go out, just know your limits. Don't try to overdo it. You know, so some people can go crazy, but you know, if you go crazy, it would end up.
Do
in a
you
different.
feel it? Does the body give you any warning?
It kind of does, yes.
It does.
Kind of does, yes. Like you can feel. Okay. Yeah. Besides the pain, there's another type of feeling that comes with it. There's a feeling of like tiredness. So once you reach that point, you're like, okay, I need to stop. I need to slow down.
Yeah.
So
And then you listen to your body.
you listen to yourself.
That's almost like my motto on this show. anything that's going on with you, listen to your body
Yeah,
because it gives you a lot of warning signs. Has it been limiting in terms of like your work life? Has there been any changes at all?
Okay, so yeah, when I was younger, I couldn't. It was hard to keep a job, and it's because you have a
Really?
job, you end up in hospital 2-3 weeks, you come back, they look at you funny. They don't really believe like you've been in hospital for that long.
Yeah.
So yeah, it was very challenging for a long time. I wasn't working, but
You weren't working for a long time.
yeah, for a while. I wasn't,
Yeah.
but then I started my own business, so
You
I'm
did?
pretty much.
Oh, you didn't tell me about that.
Yeah.
Right. Oh, okay. So, how many years, for instance, were you able to hold a job? Working
I
for
haven't been.
somebody
I haven't been for. It hasn't been for like more than a year. I don't think.
more than
I'll
a
say
year.
6, 7, 8 months, and then I'll have
Oh,
to.
that,
leave.
that's been on your own, working for yourself.
No,
No, then he has
working
to find another
in a
job.
job. in a
Really?
job, yeah.
Wow.
So,
You see, I came across a lot that the sickle cell patients have put out there, and they said it shouldn't stop you from doing anything at all.
no, it shouldn't. I mean,
It shouldn't. Is that the kind of mindset people should have to live with it?
Okay, so with sickle cell, everyone's different.
Everyone is
It
different.
affects everyone in a different way. So, once again, listen to your body, know yourself, know your limits.
Yeah.
So, with me, I would say it doesn't stop me unless I'm ill and I'm down, I can't move up. Then I'm living life,
Yeah.
a normal life. Yeah. So it doesn't really stop me.
Yeah. It doesn't
No.
at all. So we can plan a
Unless I'm
night out
down.
that
Yeah, definitely.
me and Kwame going out on a night out with permission from whoever wants to have permission.
He's an adult now. He doesn't need permission.
Doesn't need permission from anyone. Yeah, I mean that is very interesting to know because when we discussed 2 weeks ago, we were trying to see what is ethical and what is not. Like, how do you tell people, because we know how the disease comes about, isn't it? And a lot of the things that will be discussed will be making ethical decisions and choices about whether you go into relationships knowing full well that the partner has sickle cell disease. And so with that, I'm going to go across the board. You were married to Kwame's dad, you said. Did you know anything about sickle cell at that stage?
I did, and I knew that marrying someone who had the disease or the trait
Yeah.
would end up with you having children with sickle cell.
Yeah.
But when I asked him about, he knew my condition and everything. When I asked him, he said, "Oh, no, we don't have it enough." And I believed him. You know, it was like,
Just took his word.
yeah, it was nice. You know that to know that. Oh, he knows he hasn't got it, so nothing will happen.
Yeah.
You know,
And it
and
just went by.
oh yeah.
Kwame, you being a young man, what do you feel about that?
About
Relationships and wanting to know what the other person is carrying.
is carrying.
Or- yeah.
It depends, unless you're going to go through every relationship, asking the person. Right. So, but I'm open about it. I
You-
talk
yeah.
about it. I tell everyone about it. So, yeah, and it's been okay.
It's been okay.
Yeah.
How receptive are people to talking about sickle cell disease? Like when you hook up with a friend,
Yeah.
a girlfriend,
Okay.
or a friend. Let me put it generally, and you want them to know about their status. What stage in the relationship do you think people should know about it?
Everybody's different, but with me, from the beginning, most people know I have sickle cell from the beginning. So right from the beginning.
Right from the
Then,
beginning.
yeah.
Yeah.
So
So even before you hit the ball running, like anything like that, it's like
yeah,
this
we
is me.
talk about it. This is me.
Would you say that is important?
It's important because once again, everybody's different because it affects everybody differently. But I would say if you're planning to take it further, like get married, settle down, have kids, then yeah, definitely
Yeah.
it's something you need to discuss and plan
Yeah.
ahead. But with me, like from the beginning, I'm pretty open about
Pretty
it.
open about it. So if, for instance, you have a couple who are both carrying the trait of sickle cell, what would you say to them?
I can't say anything to them. It depends on. They have to weigh out their options. They have to know where they're going and they need to know what comes with it. Like in terms of managing. I have a friend of mine who married his partner. His wife is so they're both carriers.
Okay.
They're both carriers. They have 3 children. Out of the 3 children, one of them has sickle cell, like full-blown SS sickle cell. The other 2, they are carriers. So
AS,
yeah.
AS, both of them.
I think AS and AA. I think I'm not too sure.
And AA.
I think so.
Yeah.
Because they were both AS.
1 in 4 chance of getting AA, AS, SS.
Yeah.
So they might all be SS, or they might all be AS, and they'll get 2 AAs. So when you put the S and A together,
Yeah.
So
Funny enough, after the first program, I had a lot of feedback, and a lot of them were people telling me about their status.
okay,
Believe it or not.
that's wonderful.
Yeah, it was just, I thought, okay, how open people want to talk about it because you brought it up. But otherwise, it's never been a conversation that, people bring up at all. And then so many of them said, I am AS, I said, okay, that's good. And my daughter is AS. And the conversation
goes
was
on.
coming up and going on, and a lot of them telling me how they've been living with the conditions, which is what I seek to do, encouraging people to be open about their medical conditions.
That's right.
Encourage others to, help their recovery and all that. Kwame, in your case, and it looks like I'm on your case a bit out of interest. Yeah. Have you also had any complications from from being a sickle cell?
From sickle cell. There's been a couple of times I've had chest infections.
Okay.
Which was quite serious. But that's happened a few times.
Just chest. I wouldn't say
No,
just chest
not
infections. It's not just, is it?
Part of the sickle cell as well.
Yeah. So do you have to take any medications
Um,
regularly?
With the
routinely?
chest crisis, so usually what happens is you're put on this red cell exchange for about 3 to 6 months to raise
Red
your
cell exchange.
red cell exchange.
Okay.
Yeah. So
What do they actually do with that? What happens during this red cell exchange?
through the red cell exchange, so it's taken. So your body pretty much generates the sickle cells. Okay. So they take a percentage of your blood out your body and replace it with so
full cells.
So
you
full
get
cells.
you get the sickle shaped cells
Yeah.
in your red blood cells. So what they do is they take some off and then put full cells in. So they do those exchanges so that it's for a temporary thing because your body will still produce the sickle
Yeah,
cell.
you keep producing.
So, yes.
So this happens through a method. It's called apheresis, and it's a machine that they put you on, and it's pretty cool. I feel it's pretty fascinating. And because the machine takes the blood, it spins it, it separates it for like the plasma from the red cells, from the glucose, and it gives you the plasma back into your body, and it takes the new red cells and puts that into your body as well. So, which I find fascinating. I mean, the first time I went on it was.
How many of these procedures have you had?
Like I'm saying, usually after a serious chest crisis, you're on there for at least 3 to 6 months. So I've had a few
intermittent treatments.
Yes, so it's like every 4 weeks you
I
have to
see.
go in until your blood levels raise back up
I see.
to a normal percentage. So
That is what fascinates me
yeah.
about this. What people encounter and how, and you are fascinated as well. I mean, I'm a nurse, but because I'm not in that speciality, I wouldn't have a clue about this, or not a lot of information about it. And so that is what I like, all the different treatments that people do. You had the same kind of treatment, did you?
Yes, but unfortunately, again, it didn't work with me.
It didn't work for you?
No.
Yeah, what was the reason for that?
I just started bloating.
Really?
My body started bloating. I started going dark, and then I had blood clots.
Oh wow.
I
Did you have a number of treatments?
Yes, I had.
Okay.
I had a few, but always after the exchange, I sort of run into problems.
Really?
And after a while, instead of the pain getting better, it would get worse before getting better. And then it got to a stage where they decided that no,
that you are not having it anymore.
I'm not having it.
So how many treatments of that particular treatment did you
Oh, a
have?
lot.
You did have
Over
a lot.
the years, I'd say for about 6-7 years,
Really?
I had that kind of
I see.
treatment. Only after a bad crisis.
Right.
Yes. But then every time there was a problem. And my veins are really difficult to access. So normally I'll have to be taken into the theater for them to insert a femoral line, and all that came with risks.
Complications, risks as well. And Kwame, how many of these treatments have you had?
I've had a few. It's more than 10 because it's been.
You've had more than 10 of that as well.
Over the past
Wow.
year, because it's happened over a number of years.
Yeah.
So yeah. Definitely.
I see. But you have never had any complications when you've had this treatment?
No.
Nothing at all?
No.
Do you have any allergies?
I don't think so. No.
You don't?
No.
Your mom has a lot to share,
Yeah.
but you have none whatsoever.
No.
What do you use to manage your crisis when you are in pain? What medications do you take?
I'll say that there are 2 types of pain that you get.
Is it?
There's the pain you can manage at home,
Okay.
and then there's the pain you can't manage at home where you have to go into the hospital. So if you're at home, just drink plenty of water. That's the main thing. Paracetamol and your painkillers, whatever painkillers they give you.
So if you're on morphine at home,
Yeah.
or pethidine tablets or oxycodone, whatever you take, what your consultant gives you,
Yeah.
then you manage that at home. So they obviously tell you can take it every 4 hours. You can do this. They give you a regime, and if that's not working, as he said, when you cannot manage it at home, you'd have to go in.
Yeah.
Because how much can you drink? So you would need IV fluids. So you might not be able to drink 5 liters of water,
Yeah.
in a 24-hour period, which you do need a lot of fluids. So he can, as he say,
Yeah.
I need to be in hospital now.
I see. Yeah. So on a scale of 0 to 10, assessing your pain, how bad do you get before you say it's enough is enough, I need to get into hospital?
When you're rolling on the floor screaming. That is
Or when your children tell you that, Mommy, it's time to go to the hospital.
To go to the hospital.
Yeah.
Then
I think sometimes too, people don't want to go to hospital because of the stigma, and also
Yes,
when they go into
yes.
hospital, people don't treat them well.
Exactly.
Especially if you go to a hospital that cannot manage or are not used to managing sickle cell.
yeah.
So they want to stay as much as possible at home before they go.
Yeah.
So that also hinders people. So where they want to go, it's better to go in early and have the pain relief, IV, oxygen, everything, and then go home, than wait till when it gets to a certain stage.
sometimes you think it's going to be okay.
Sometimes you think you'll be okay as
That's
well.
the thing.
Yeah.
Sometimes you feel I can manage this.
Yeah.
Yeah.
Or another day it will get better by tomorrow.
Yeah.
And
And it lingers.
it goes on, and to a stage you can't even drink because you just don't feel like eating, you don't feel like drinking.
Yeah.
No.
So apart from chest infection, you have not had any other complications as such?
No.
No.
The chest infection. Yeah.
Good to know that. Yeah, it's reassuring.
Yes, very.
So Auntie Ruby, I'm back to you.
I don't know what I did wrong.
I don't know. I don't know. But this is your book,
Yes.
60 Miracles.
Mm-hmm.
You see, what amazes me is every single patient who has come to give an account wants to write a book. Yeah, there are so many of them that I've done about 5 patient accounts, and they have started writing or in the process of writing a book, and it fascinates me. But in your book is at least here, and I've read it, and I thought, should I host her alone? Should I do it together? Because I was quite shocked at some of the things that you had to go through. So now you've mentioned about the transfusion and the effects, how you felt unwell with it, and that was not until your second pregnancy, isn't it?
Yes.
Yeah. Are you having to have any regular transfusions?
No, not anymore.
Not anymore.
Not anymore because of the complication of blood clots and difficulty in accessing my veins.
Yeah.
I've not had any transfusion. Well, no. The one I had was for iron.
Iron
That was
infusion.
iron infusion
Iron infusion.
last year.
Last year.
Last year.
Yes.
So otherwise, sorry, carry on.
Yeah, otherwise I've not had any blood exchange for I think over 10 years, I would say.
Really? How regularly is your HB monitored?
When I go into hospital.
Just when you go into hospital? Right. I gathered from here that there was a certain phase in your life that there were so many complications.
Yeah.
So many of them. Yeah, start from the notable first one and just talk us through that. Or let me limit it this way. You had a blood clot in your brain.
Yes.
How did that all start?
I was in Ghana on holidays. I don't know how it all started, but I kept feeling dizzy. And anytime I go out in the sun, it seems as if everything was so bright and red at times.
Yeah.
And I remember that I tripped and fell. But I didn't hit my head or anything of that sort. And I was a bit okay, but I just kept complaining that something wasn't right. So I went to Acute clinic and I had a scan done, and I was told I had a blood clot in my brain.
Right.
I mean, I was really, really surprised.
You were still walking.
I was walking. I was doing everything okay, but I realized that as the days went by, I was starting to feel heavy. Any step I took was really,
David.
yes. So it was coming up to Easter. So the surgeon who saw me said, I think the best thing for you to do is to jump on the next flight to London. And I was like, I really don't think, I have a feeling that if I go up there, the clots might shift. And he was telling me, no, it wouldn't happen that way and things. And I went
What was
home.
the reason for that? Was it
Because all the, what he said was, the good doctors were all going on holidays. It was Easter. And I think that day was Maundy Thursday or so.
Yeah.
There wouldn't be any good doctor to attend to me. And he felt that the best place I could have treatment would be when I come back to London. So I went home, I told my mom, and they got into the phase of trying to find someone to accompany me. And that was the last I knew. I then woke up and someone asked me, "Do you know where you are?" And I said, "Oh yeah." He goes, "Where are you?" I said, "Oh, Hammersmith Hospital." Because when I looked up, I realized I was in hospital.
Yeah.
And then he said, "No, you are in Kolibu." And I went, "What am I doing here?" He says, "Oh, never mind. We'll wheel you to your room." And then the next thing, I found my late brother looking at me and asking me, "Do you know who I am?" I was like, "Of course, I know you."
Yeah.
And he went, "Good." And then my brother-in-law too went, "And what about me?" And I said, "But what are you people doing? I know you." And then my brother went, "Oh, good, good, good. Okay, you just rest." I didn't know anything had happened to me. You know, the next thing, a doctor comes in trying to, and I was like, "What's going on here?" And they told me I've had surgery on my brain. And then I had to touch my head and realize it was half,
All your hair was shaved.
and there was a tube just hanging. And I was like, I kept asking everybody, "What happened?" And no one could tell me anything. I was trying hard to recollect how I got there.
Yeah.
But
Still never recall.
it was not until I went home that I was told the whole story, and then bit by bit I started recollecting. But from the day, the last thing I remember was leaving Akai, and to date I don't know what happened till the day I woke up.
Wow. Yeah. So you recovered from that too.
I did, yes.
When was the last time you were actually in hospital for anything?
Exactly a year ago,
Right.
I was in Hammersmith Hospital. It was with this same iron thing I was just
Yeah.
talking about. And one day I just woke up and all I could see was black. And I just couldn't understand. I remember the day before, one of the nurses was helping me walk. And when I look at her face, I could see blood like running down her face. So I said to her, "Oh, you got blood on your face." And she was a Nigerian nurse, and she went, "God forbid." And I was like, "Oh, maybe it's me." So I just kept quiet, and I realized that anywhere I turned my head, I could see blood. So I asked her to go and call me a doctor. Then the doctor came and he said, "Oh, don't worry, I'm sure by tomorrow everything would have..."
Were you hallucinating?
No,
No.
I was bleeding behind my
Aye.
eye. It's part of the sickle condition.
Wow.
And I had bled so much that it had formed scar tissues, and the blood was starting to dry. So all I could see was black.
Okay.
But I was so lucky I was in hospital then.
Yeah.
So the next thing, they just whisked me to the Western Isle hospital, and they gave me some injections and asked me to come back the following day. And I had surgery
You had
done
surgery again on your eye
on my
this time.
Yes, it's this then the I think fourth surgery I've had on my eye. No, fifth.
On your eye.
Mm.
On your beautiful eye. There was one instance I read in your book
Yes.
where somebody said, "Oh, I think it was your husband," saying something about the baby, that let them take your eyes
Yes.
and your smile,
Yeah.
but not your nose.
Not my nose.
Oh gosh, yeah, I read that and I was it's all it's the whole package you take. I see. Yeah, I found the book very, very interesting, And I would
Thank
say, you worked at BBC in Ghana, isn't it?
GBC.
Oh, GBC.
Yes.
GBC.
Yes.
Even
Mhm.
in Ghana.
Yes, I
And
did.
so writing comes easy, and you are a journalist.
Yes,
as well.
I'm a journalist.
So
as well.
writing sort of comes easy.
I love writing.
You love
I love
writing.
writing.
Yeah.
And I'm always putting everything down. If you ask Marjorie, even in the hospital, anything that happens to me, I take that yellow menu and I write things down. And
so in her book, you can see things stuck in there with different things she's written on.
You know, nurses are uneasy when patients are documented.
yes,
Yeah.
that is, I had problems with that.
You did
Yeah.
have
Yeah,
problems
because
with
some
that.
people
So they
thought
think
I was
you're
reporting.
them. Yeah.
Yeah.
And so they get to know that it's just for her own memory and for her own thing. That's okay.
Yeah.
If you go to the same, now most people know you on the ward. So when she goes to that particular ward or any of the hematology wards, she's okay. But if she goes to another hospital, another ward, then that becomes a problem.
Problem.
Yeah.
Yeah. Do you try to allay their fears by telling them that don't worry, I'm not doing anything sinister, because we, nurses are just uneasy and they think.
No, I think sometimes they feel uneasy because they know what they've done wrong.
It's not always wrong.
It's not always wrong.
always
Oh,
wrong.
I've got wonderful nurses
Yeah.
who looked after me. So wonderful.
Yeah.
So wonderful.
Marge, do you?
The leader of the pack.
Are you aware your name is in this book, Marge?
Yes.
You are
I have
aware.
a copy.
Lucky you. I wish I was in the scene. I would love to be here too. Yeah, but I think it's amazing. Let's see. A few people are watching on Facebook, and let's see if I can get Samuel Asari is watching. I don't know whether he knows Kwame. Kwame, any relation? Someone called Sam.
All right.
Asari is watching. Alberta Bruce says, "Go girl, no more wheelchairs." And that is for you. And she says, "You are such a survivor." You know what, guys? If you really want to get the hang of her survival story, I would say get 60 Miracles. How long ago did you write this book?
When I turned 64 years ago.
4 years ago. So it's been around for a while.
Yes, it has.
And
It has.
the inspiration, like reading this, the inspiration that it gave to me.
That was the idea.
That was the idea.
Yes, because a lot of people treat sickle cell patients with a sort of negative attitude, you know, and I feel it's not right. I really feel it's not right. We're humans, you know. It's just a gene gone wrong. We're just like anybody else, you know, and the stigma attached to it is so great.
Right, you have to expand on this one. So one, I want to know what negative attitudes or vibes do you get? And
I think it's mainly to do with pain relief. Because of the type of pain relief that they have and how often they have to have it.
yeah,
So you obviously you're having pethidine every 4 hours or every 2 hours.
2 hours.
Yeah.
You're having morphine. So you're having all the fentanyl. You're on a pump, morphine pump. You are, so people think, oh, they all they want is to have a fix of drugs, to have medication, and so they can also look at it, oh, you're addicted to this medication,
yeah,
but that's the only thing that works for this person
yeah,
to help with their pains, because they don't understand the pain they're going through. So even some of the nurses that work on hematology wards do not know about sickle cell.
yeah,
They don't know about sickle cell, and they don't know what people go through with sickle cell. So they do have some,
reservations
about it. So the even in Ghana, there's not a lot of awareness about sickle cell.
No, there is.
Even in Ghana, I didn't know about sickle cell until I started nursing.
yeah. So
And
you
it's
can
something
imagine
that we have in Ghana. You see,
more of in
yeah,
Ghana.
because of our the tricks. So I think it has to start from there somewhere. We have to start from somewhere. Something there should be awareness, because even parents.
And that is what we are doing now.
Exactly.
Yeah, because even some people they don't know they have sickle cell, or their kids have traits. and they've had a child, and the child is complaining of pain, of mommy, my joints and this or that, and the parents don't. Oh, you are lazy.
Exactly.
Or you are always. Oh, you are always feeble. You go to school and play football, and you have a fracture or some pain. People don't take it seriously because they don't understand.
They don't understand the condition the patient is presenting with. It's more difficult, I think, when people present differently, isn't it?
It's true.
Yeah, because
it's
you
true.
see, like in cardiology, for instance, a lot of them will come with chest pain. And I tell people, not everybody will have chest pain. Other people will present with shortness of breath, for instance. So manage your patient and don't always look at how quiet they are. And there was one particular incident which I always remember. Patients' observations going the wrong way, getting tachycardic, showing signs of sepsis and reacting to something. And the patient was on PCA, patient-controlled analgesia. So they were lying down fine. And we were running around, because the observations were telling us something different.
Else.
And the patient was wondering why we were running around. Yeah, and he was having a full-blown attack, heart attack, obviously.
Because he was on a pain relief as well, so he didn't feel the pain. Yeah.
You see? And so this is just not for the public, it's even for health professionals. Manage your patient closely through observations, and that is the only way you'll be able to pick some of these things up, Otherwise, you will not. Your allergies. Our producer wants to put them on. Have your allergies, the whole long list of allergies on the screen. Yeah, because I want people to know. And the reason why I am saying this is because you had some medication in hospital. And reacted, and the patient nearby, that I gathered that from the book. So I read it, right? Yeah, vancomycin.
Yeah.
You were having, tell me about that.
That was when I had my gallbladder out. And she's still my friend. She's called Sue.
Is it a nurse?
No, a patient.
Yes. Patient, the one
she was lying right opposite me. And anytime they gave me the vancomycin, it was as a drip. I mean, my heart starts beating, everything just starts going bad, and it would go that way till maybe by the next morning I'll feel calm and okay again. So I think the third or fourth time she alerted me and said, I've really noticed something. Anytime they start this
infusion,
that is
restless,
that is when all this happens to you. Have you realized that? And I said no. And so I told the doctor that this is what this lady told me.
Yeah.
So the next day the doctor was there himself when they started administering the vancomycin.
Yeah.
And the obs and the things just told them to just stop.
The vancomycin also
immediately.
Yeah, so which antibiotics can you have safely? Surprisingly, I didn't see penicillin on the list.
I take that every day.
Penicillin V.
Pen V.
Yeah.
As prophylaxis.
Yeah.
Twice a day. And the ones I can take is amoxicillin and clarithromycin. Yes, those are
safe to take them.
Yes.
Wow.
Yes.
For now.
Fingers crossed.
So far, so good.
Yeah.
We thank God.
Right.
Yes.
Let's see. There are a few people joining on Facebook, and let's see what they've written. So I have Alberta says go girl, and obviously no more wheelchairs. We've established that we don't want that anymore. Yeah, Samuel says God is not dead. He's not. Charlotte Marty, hi Mom Ruby. This is Charlotte Teshi watching. Your
Okay.
yeah, and Mom Salome is watching as well. Yeah, Francisca Ameyao, she had a stroke years ago and was on the show to give an account of it. So I think she relates to the blood clot in the brain.
Right.
Yeah, and following that, she's become a stroke nurse and doing really well as well. Yeah. So there are always success stories when it comes to these conditions, and they all are thanking God for your life. And your name Abe says, Ruby, we thank God for your life. And I think Pauline is watching. Ifia Boatma says she's so beautiful and blessed. she really is amazing. She really is amazing. And San Kwame, I thank God for you too. You guys are more than conquerors. And that is from Pauline. Debbie Nanatando says she's giving me so much hope. And this is what we aim to do. I am 33 years old who suffers with sickle cell, and watching this has been very informative. You see, and that is what we aim to do. And there is a question. Debbie is saying, does sickle cell affect white people too?
That's the big question. They're saying now,
years ago, when I was still in Hammersmith, when I was still on the wards, they were saying that because of intermarriages, there's been 1 in 1,000 whites has SS because of intermarriages. They are white, but they have genes because of intermarriages. But the thing is, you know, the Mediterraneans, they have there's AS, AC, SS, SC. In those are the sickle cell traits.
Yeah.
So the Mediterraneans have the SCs and ACs on that, and they also have thalassemia and all those things. Yeah.
On top of that, I have thalassemia as well.
You have sickle cell and thalassemia as well. You said some of your siblings have a sickle cell disease as well.
Yes, my older brother.
Your older brother has it. Any other family members who?
My cousins. I've got cousins who got it. I've got friends who have it.
Wow. Yeah. Creating awareness is key, isn't it? People will recover. And always people like to know where can they get help. So I had a message from a friend, and there is this group. Let me go off and see if I'll find the message, because there is this lady who I'm sure is somewhere here in the UK and said they have an association and they can help people who have sickle cell disease. So I'm going to find the name.
I know there's a sickle cell society.
Yes.
Yeah.
And I know there's also one in Brent.
Brent, yes.
But I don't know any. I know Marvel Brown, and the other lady that used to come.
Is it Elizabeth Enyo?
Yeah.
Or
that was the Indian lady with dreads.
Yeah, I've forgotten her name.
Yeah,
now.
she used to be the
I know.
I think in Hammersmith, we were blessed because we had, because of Brent as well, we had people with, who were interested in sickle cell and were helping sickle cell patients. So when you're admitted, we used to contact them. They will do the sort of, look at your,
like Kofi Annie, for instance. Yeah.
So they'll come if you have kids. They'll look at if your kids need your help, or your family, things like that.
Yeah.
But there are not a lot of them. So not all hospitals have that support.
Right. So this lady saw the flyer for this program on a friend's like DP or somewhere on a friend's platform, and she shared her name with me just before I came into the studio, and she was going to be watching the show tonight, and she says she's Marie Claire, and the message that accompanied this, I'm yet to make contact with her actually, but I thought it's very interesting just seeing the flyer and wanting to make contact. And this is what she said, sent to me. She said she has got sickle cell herself and has 2 children. And what they do is they support people with sickle cell with all sorts, financially, service-wise, and the people can access these and they have a helpline as well.
Oh, wonderful.
Yeah, so I've not even made contact with Marie yet, but Marie Claire, if you are watching the program, thank you so much for getting in touch through a
Exactly.
friend, and I definitely will make contact with you. But there are other sources, isn't it, of help that you've said?
With the Sickle Cell
Sickle
Society.
Cell Society.
And also they had the like it's a sort of a social worker type thing
Yes,
that they
yes.
had, but they're not accessible to a lot of people.
Yeah.
I think because Brent had a lot of West Indian. It's more a West Indian sort of community that started that. So it's not they don't have it in all hospitals. They don't have it everywhere. So that's the other thing. It's not something that is accessible to a lot of people.
Yeah, but it's always good to know that there is help out there.
Yes,
There is help
it
out there
is.
for people, and they do not have to suffer in silence. I was hoping that the list will come for. It's ready, right? Yeah, let it roll. We want to see all her allergies. It's fascinating. I really find it very fascinating because I thought when I see like 10 allergies of patients, oh, it's fine. I've seen that list before. Yeah, but this is carrying on over like pages of it. And I thought, wow, you know, somebody just needs to give you something without knowing, and it's enough to
That
trigger
is true.
Trigger something.
Yeah, that's what happened when I was given fentanyl injection.
Fentanyl injection.
At A&E. That was it. When I ended up on life support.
Just after having fentanyl injection.
Just after the fentanyl.
What did you go to A&E in the first place for? Like,
because I was
had a
in
crisis.
crisis,
And
and
then-
for days it wasn't going away. Days
was it
upon
in this country?
yes.
Right. So they
Days.
tried to help you.
So I went in. My cousin drove me there. We got there. Then I don't even remember seeing this nurse, but she was the one who told me what happened. I don't remember seeing her. She said she came to sit with me, and then the nurse came, and as soon as she gave me the injection, I said to her, "You've killed me." And she asked why, and I asked her, "What did you inject me with?"
Was it before that time? Was it documented as one
Yes,
of your
it was
allergies?
documented, but I think in her haste, she did not really look
Really?
and gave me fentanyl, something that it was there that I was allergic to. And
I find
she
that-
said, she told me that don't worry, the next dose I'll give you your right painkiller.
I find that very hard to believe, obviously, because fentanyl
I
is a
don't
controlled
know.
drug. It needs 2 nurses to check.
Mhm.
Yeah, how long ago was this?
A few years.
Yeah.
Mm,
Yeah,
yeah.
a few years back, quite
Yeah.
a while back.
So we have on the screen now your allergies.
And the dates.
and the dates. That's amazing. Yeah, we start from the top with morphine from 1996. Isn't it?
Yeah,
And then we
yeah.
go to dimorphine,
It's
and the
around the
list is
time I
endless.
was using it.
Yeah.
We have
That was the first time.
Tamgesic in 94, fentanyl. So that was for 2001. Yeah, and the list is endless. Pregabalin, Voltarol, coming in 2009. So what would you say is your last documented allergy, or what year was it? Do you even
Can't even remember
The
now.
list is such a long list
It's a
of
long.
allergies. So yeah, so this
It goes
particular
on.
one took you into coma.
Yeah, I had to
dear.
have trachea. And
Oh my
I remember
goodness.
you came to see me, and that was another thing.
Yeah.
I can't, up till now, I can't remember anything.
About it.
I can't remember anything.
Okay. Anyway, yeah. So we have somebody watching from Takoradi in Ghana as well. I was watching from YouTube and have a ton of comments there. But since you are not reading them, I've had to switch to Facebook. Yeah, Sky Kwame. I I'm so sorry. I'm only seeing this one for the first, like your comment for the first time. So, Kwamina, if you are watching, it's not deliberate at all. It's not deliberate at all. I'm not even seeing. Yeah, but if you don't mind, just send the question through. And Debbie Tando is saying, may I ask what painkillers she takes when in pain, as she's allergic to most of them? I like that, Debbie. What do you actually take?
Paracetamol.
And
oh dear. Pethidine injection.
And pethidine.
When I'm in hospital.
When you're in hospital.
But at home, the only thing I can take is paracetamol.
Yeah.
Which makes me sleep
24 hours. She takes 2. That's 1 gram.
1 gram of paracetamol. So you take 500 milligrams. How often?
Twice a day.
Just
if I'm in pain.
If you are in pain.
Yes. Twice a day.
So that's like hardly anything, isn't it? Yeah. For how much?
Because if I take more, I just keep sleeping.
Yeah. Kwame, now I'll be waiting for your question alone. Yeah, because you've not put them on Facebook yet. I will certainly be waiting for your questions. But we are just about to draw a curtain on tonight's program. But I'm sure it's been extremely insightful. So, Matt, let me start from you and come this way. Anything you want to say to the people watching about managing the sickle cell patient?
I mean, first of all, people should have empathy. It would be something that another thing that I think all nurses or all doctors and nurses should make themselves, familiar with sickle cell disease, how to manage it. There's a lot of information on NICE about what to do when somebody comes in, what, medications to give, how to treat them. And it would make life easier for both patients and us as healthcare workers to manage them. So that we would give them what they need and make their life a bit more, better for them. So we don't want them to be in crisis and stay at home, because they don't want the way when they come into hospital they will be treated. Because people don't understand. What they are going through, especially in the first in A&E. I think there should be a protocol in every hospital about when somebody comes in a crisis, what they need to do. To stop. I think recently there was a problem about a young boy went to hospital in crisis, and he ended up passing.
Yeah, he kept calling for oxygen, and it wasn't, so he had to call 999 and to ask them to bring him some oxygen, but it was too late.
Wow.
So we need a lot of awareness out there for healthcare professionals, because there are a lot of people, even nurses in hematology, unless they come across a patient with sickle cell, they have no clue.
Wow. Finally, I managed to get through to Sky Kwame has been able to send something through, and he says, I've had the privilege and pleasure of reading Ruby's book and know it's a gold mine of information. Kwame, you can't put it any better. It's very true. And he goes on to say, for both patients and medical professionals, it should be a reference point for sickle cell disease. And that's coming from my tardy brother, Kwame, thank you so much. Thank you.
Wonderful.
And I think it's wonderful. It chants across this book. I was glued to it like this, watching and reading it and trying to go through it. You see, I am into monitoring acutely ill patients. And I think sometimes you work with other people and they think you are overdoing it. You see, but then I was thinking about it when we did this topic the other day. The fact that clots are forming in a blood vessel. You see, if anyone is a nurse, you must know the risk clots pose. it could block any vessel, including your heart vessels,
yes,
and
exactly.
lead to a heart attack. If it's in your lung, it leads to pulmonary embolism. If it's in your brain, it leads to a stroke. So these patients are potentially critically very ill.
Exactly.
Yeah, so I would be particularly interested and watchful if I have a patient, and that is what sometimes sets us apart, the fact that you are mindful of the potential risk or danger a patient can be in when they come and you look at their medical history. Yeah. So they are saying, there's a question from someone actually saying, could you go through the account after the other of her medical history?
That would be long. That would be
history.
That would be long.
Yeah, that is a whole show.
That would be absolutely a whole long topic.
Because we want to satisfy people, I think what we could do is take those that sent you into very critical condition. You see, the reason why I add this on is because you wrote 60 miracles for a reason.
Yes.
Yeah. You were not given a chance, or they thought you wouldn't make it to 60 years.
That's the thing.
And you did.
I did.
Yes.
I did.
And that is what brought this book
Exactly.
into being 60 miracles. Yeah. So tell
because
me
at
about
every age,
yeah.
I remember being told I wouldn't live past the age of 12. Then if you don't have a kid before you're 25, you'll never have a kid again.
Yeah.
You wouldn't live past 30, and they stopped at 50.
Yeah.
So
they stopped at 50.
yes. After 50, no one said anything to me again.
Yeah.
So when I turned 60, I decided that yes,
Yeah.
let me just let them know that I'm
It's
still
so
around.
unfortunate I missed that part. So I'm looking forward to the 70th one. I really am.
There's another one coming up,
Soon.
and that's
Sooner than 70.
sooner than 70.
Wow. Hopefully, let me book my
you launched
place.
it in Ghana.
Yeah.
Yes, yes.
Right, on the screen now, our producer has got some of your history there, your medical history, so people can see. And let me see if I can have a look and go through some as well, because it's what we used to say, one logo line. It's really deep. Like in 2005, that is when 2013, that is when you had that clot in your brain, and then in 2007 you have a deep vein thrombosis as well, all related to clots.
That was to do with the blood transfusion. When I ran into problems with the blood exchange.
Right. And then you had left shoulder decompression, 2008. You had an operation and you had a very bad abscess. Yeah. And there is one in 2006. That is a whole book on its own. Yeah. And in the A&E department, I think that is when you had anaphylactic shock. As a result of having the fentanyl infusion. So even more to come. Let me see if I will find some more. But all these are very life-threatening conditions that other people may not survive.
That's true.
If they don't keep an eye on the history.
Because the other thing is sickle cell also, because of the way the sickling happens, you get pooling in joints, you get pooling in different joints, in different parts of organs in the body. So one of the side effects of that is having clots. Having problems with hypertension, having problems with your eyes, having problems with the lungs. So it affects all the systems in our body. So the other thing that we need to do, especially of the GPs, should make sure that they are checking your blood pressure, hypertension, having your eyes checked. They should actually have their eyes checked every year or every 2 to 3 years to have a look in the back of their eyes, like how diabetes, they have that every year. But those things are not in place.
No.
Because it's not something that is a major thing for the UK. Even back home in Ghana, they don't have these. They don't have this. You only have a crisis, and then you're treated, and then you're back home. And so these are it affects all the organs, and so they have to have all these checks done. so that to prevent, you know.
I think people just have to learn to take charge of their own health, and that is the only way going forward, and be happy to talk to people, because like she had a lot of comfort telling you stuff, so you sort of give them a guide. There is always someone to talk to, isn't it, Kwame? I think I want to know your final take on relationships and stuff like that, not limiting you, just go for it, but ask questions, isn't it? Would you say? Ask questions from your partner or from whoever you are in relationship with, right?
Just have that discussion about it, talk about it, decide if that's where you want to go, know a lot more about it. But you wouldn't say that should be a barrier to anyone getting into a relationship, like getting married or anything like that. It shouldn't be. In terms of if both people have sickle cell, then I would say no.
You would say no.
If you're both sickle cell, it's hard, because then there's a chance that your kids will have, or maybe even if you have 3 kids, all 3 kids can be SS. So even if having a relationship with someone who is AS, it's still a little bit higher risk. So if you get AA, somebody who is AA. So that's another thing. When people are getting married or thinking of getting married, I think especially first thing is to know what your status are. So blood tests to find out what your status are, even everywhere, back home, everywhere. So that then you know before you get into, if you're serious about the person, you have the conversation, and then you have the blood test. So if you know your status and you still want to get married, then you know what to expect and how you're going to deal with it.
I would say it's also the energy you both carry. If one person has very high energy and the other person is not too sure about it, then it wouldn't work out. But if both of you are in unity, like he says, you're equally yoked. You have that belief in yourself. Then definitely you can go for it.
You can go for it. Right. Amazing. Right, Auntie Ruby. You are a miracle woman. Honestly. I had Manajwa come here, and she had sepsis and then recovered miraculously, because she was in coma for like weeks or months, and she calls herself Miracle Girl 2017. And I know you are watching this. You have a miracle mama here as well. Amazing. What would you like to say whilst we round off?
It's not easy. The journey hasn't been easy, but with good friends, good family. You ran away from hospital once to go for a night out, didn't you? That was between the two of you. It was your secret, isn't it? Yes, I did. Don't think you'd advocate for anyone. No. Tell me about that. You round up, really. I mean, I think it was Amachi Dede or so who was my days. Coming to play, and I'd already bought the tickets, but I ended up in hospital. And I decided, no, these tickets can't go to waste. I'm going. So I discharged myself. You self-discharged? Yes. Wow. Went. And Marge happily carried you? No. I told her she wasn't happy about it.
I was not a party to it.
Oh, you were
but
not a
I
party
went
to it,
all the same.
Yeah.
And hours later, I was back in hospital.
That is such a wrong move.
Very.
Anyway, so it's been such an amazing session, and let me just read 2 more comments. So there is one from Epia Danswa, who is saying the belief in Ghana is that sickle cell patients have very short lifespans. Seeing this lady has disproved this. Is it a sheer lack or good care in the UK that has kept you alive? That is a very important question, isn't it? Would you say? Think it's the way you accept it, the way you accept it, and the way you know how to go about it, how to manage your pain, make yourself happy. I think
That's also important.
That's very
Don't just
important.
dwell on the fact that you got
condition.
sickle cell. You
I
know.
think the care from your mom being a nurse and
That's
the care
also-
from being, when you were young, and what she was doing to support you and everything, and the support you also had from your family and friends also spurred you on.
Yeah.
Because they're like, oh, if you get pregnant, you're going to get unwell, and then you might lose, like,
Yeah.
things like that. Care in the UK helps because obviously we've got access to hospitals, maybe let's say quicker than where if
And
somebody.
the fact that there is no cost attached.
Absolutely. But in Ghana,
Yeah.
if somebody has a crisis, then they go into hospital. You have to pay
Yeah.
for medicines. You have to pay for antibiotics. You have to pay for IV fluids. So people don't tend to live longer because they don't get that care.
Yeah.
See.
Absolutely. Yeah. So let me read one more comment. Irene, I know she's Irene Boham. She says, "Thank you so much, Winnie, for raising awareness with your fantastic program." Thank you, Irene. You are making a difference and improving lives. Thank you to your wonderful, selfless guests for sharing their experiences. And for me, in doing all of this, I find it is more satisfying. I do appreciate the professionals a lot, a whole lot. Out of their busy time, they take time to come. But everyone by now knows that the patient account,
Of course.
for me, is a star.
Yeah.
Because you get to know that out of everything that people are going through, one, they make the links and find solace in their relationships. And all those who have been successful in dealing and living long and beating all these conditions, they are as bubbly, and I don't think I've met anybody as bubbly as Auntie Ruby. Yeah, I think you have been absolutely wonderful. So on that note, I would like to say a big thank you once again to you all for coming. Yeah, Marge, you are my buddy, my classmate, so we link up a lot. But still, you were really, really happy to be part of this, and I think it's come out well, given the professional side of things, how we can manage these patients and make sure we are giving them of our best. Kwame, from a young man's point of view, I think you've been awesome. Yeah, coming out to even talk about the condition and wanting to share how you've managed and all that. It is so reassuring and refreshing as well to have you on the show. And then Auntie Ruby, you are such a gem. You are such a gem.
It took a while. We tried to coordinate it.
Coordinate it. Yeah, I would say if anyone really wants some kind of comfort and reassurance going through very difficult health conditions, you need to read 60 Miracles, how she made it to 60 years and beyond. And you will be amazed, because I found there are times where you thought you were knocking on heaven's door and walking with angels and being at the gate of like a morgue and all that mind-blowing stuff from this little book. And you see, I'm not a big reader.
These are just little insects of
the things that happen.
Yeah.
So for all the patients who want to write their books as well, she can easily give you help.
Yes, exactly.
And Francisca, I'm really referring to you because you really want to write the book, and you have to. If she has done it, every day put something down, and I'm sure it will come to life, isn't it? Eventually. Yeah. So once again, we'll say a big thank you to Omega House, Omega Live TV. If you want all your print works, marks, photo frames, bottle openers, anything you wanted to add, handkerchiefs, mouse pads, beer glass, pillowcases, t-shirts, clocks, you name it, anything to do with printing, they are the best in the job. And before we sign off as well, like I said, this is the last program for the year, so let's talk about health. Has been going for 2 years, and how I've managed to carry on, I have absolutely no idea. So I want to take the opportunity to thank Omega House TV for allowing me to just carry on doing this program, to Uncle Joe and to all the team, Kula, Archbishop, To all the team out there from Omega House, I'm so grateful. Mami Danswa, you are simply the best. You know who I'm talking. And then to my family, my kids, and my husband. I mean, he's the best. I would say that, because he's always carrying me around the country. Anywhere I want to go, he's with me. Yeah, because we finished these shows late. So how am I going to go back on my own? But he's always behind me. And then my sister, she sews all these beautiful outfits for me. I don't have to pay a dime, so don't size me up. I'm not rich. My sister just does these things for me because she just loves, and she's always supporting what I'm doing. And then I will say once again a big thank you to all the guests who have featured in the past year. Like I said, Harriet Nsua, Trowbridge Foundation, Douglas 24, Adam Mapani, Nanajwa, Dr. Khan, and of course my last but not the least guests, you guys, for taking your precious time to educate us on the public. Now I'm going to say that I really need us all to get into the habit of contributing to support-worthy causes. So on that note, I will say the Trowbridge Foundation are actively involved in training to improve maternal health in Ghana, and I've been hosting them a lot. They do an amazing job. I need you guys to sort of donate, even if it's like £10 a month or a little bit. Donate to support them, and also to the Irene B. Boham Nursing Scholarship Scheme. And we launched it the other day. She is into nurse training, taking brilliant nurses, students with very good results who can't afford to go through the training, and she is doing this to pay their fees throughout their own course, their whole course. How amazing is that? And then obviously Harriet and so on talked about breast care in the UK and the amazing care she had. So I am saying this on her behalf for Cancer Research UK, especially in breast care. Please, let's take time and donate to these worthy causes. Even if it's a little token, you can imagine how much we can do to help all these worthy causes. And on that note, I cannot wait to see you all in the next year. My guests are having a party for me. So there is so much to enjoy, but obviously I can't let you come through to enjoy it. But yeah, I will definitely enjoy it on your behalf. So on that note, I will say thank you so much. A few of those watching, Eunice Nana Hagan, amazing, you are an inspiration. Adrina Asari, I think the environment plays a great portion in the life expectancy, which is true. And Rodlin Graham saying, don't forget AC Hammond, yeah, she's my big sister. And yeah, how can I possibly forget her? Amazing, because she's always calling and saying, have you got any clothes to wear? Find me the next outfit. Amazing people who will always be there to support you. Above all, let's support each other. So until I come your way again with another amazing episode of Let's Talk About Health, it's been your host, I'm Winnie Ohinekisi, and I've been privileged to have the opportunity to do this. Don't ask me for money because I'm not rich yet to pay your medical bills. Yeah, but one day we will get there. We'll get there as we get people to sponsor. So thank you so much for watching, and goodbye. Stay safe. Thank you.